So unfiltered healing, where the mask come off, the root causes rise up, and we get radically real about what it means to heal in today's world. I'm your host, Nara Arif, thyroid health coach and wellness disruptor, and woman on a mission to help you reclaim your body, your balance, and your brilliance. Here we talk health with no filter, just deep dives, aha moments, and the kind of conversation that makes your cells tingle with truth. And today we're kicking things off with something powerful. Because sitting right next to me is not just my co host, but a radiant healer, intuitive teacher, and a total gut health practitioner.
Hi, beautiful souls. I'm Mimi, and I'm so honored to be here with you all. I am a natural health practitioner with special place in my heart for gut healing. Why? Because for so many people, the gut is where the pain starts and where the healing begins. So today we're diving deep into a condition very close to my heart, the Crohn's disease, and we will explore what really it is, why it's often misunderstood, and how natural root cause approaches can offer lasting relief beyond just symptom suppression.
And if you or someone you love has been struggling with inflammation, disruptive pain, or autoimmune chaos, and you felt lost in the medical maze, this episode is for you. We'll talk causes, triggers, and some jaw-dropping truth about your microbiome, immune system, and emotional connection to gut health. No gatekeeping here, just the tools, insights, and inspiration to start reclaiming your healing journey.
This episode is raw, it's real, and it's packed with takeaways you can start using today. So take a deep breath, pour your tea. I have my matcha here, and let's begin this journey together.
And this is
With Unfiltered Healing.
welcome, welcome.
Yeah.
So glad to have you here today, Mimi.
Thank you so much.
Obviously, I've known you for many years and we've been good friends. I'm so glad we started this initiative of this podcast. Obviously, our viewers are interested, like who you are and what you do. Can you tell us a little bit about yourself and what you do in your own
So
words?
my name is Minaam Jamil, and my friends and family they call me Mimi. I'm a mother of four beautiful children. As a former doctor of pharmacy, while raising my children, and this journey had led me to explore and embrace the natural healing remedies. So I did a couple of courses in hijama. Took prophetic medicine education from Pakistan, and then I earned my natural health practitioner certification from the Alternative Medicine College of Canada Holistic Health School in Montreal, Quebec. And here I am.
Absolutely cool. Was there a personal story or a light bulb moment, like, or kind of aha moment, like they say, that made you want to focus on gut health or Crohn's disease specifically?
Yes, so it is basically because of my daughter. And since she was 2 years old, she would always clutch her stomach. And despite numerous consultations, doctors were unable to reach a differential diagnosis. We were constantly torn between gluten allergy and stress related symptoms. I even took her out of school thinking it's something related to stress. And but her height and weight always remained balanced. So she would, distend, bloat, was breathlessness, and it was so difficult for her to eat. It's a total journey of 12 years now. She's 12.
That must have been a long journey of healing.
Yes.
What kind of training or experience helped shape the way you coach today?
So my healing practices they include gemotherapy, aromatherapy, orthomolecular therapy, herbalism, natural remedies, and prophetic medicine. So I use all of these to support my clients, and I really do vegan, plant-based products. And in the end, I pray because healing really comes from God.
Beautiful. And obviously now, you know, we are in health industry and we do know what is Crohn's disease and many as well, but some people they don't. So, for those who might not be familiar, how would you describe in your own words, or how would you explain in your own words, Crohn's disease?
So, like everybody knows that it's an inflammatory bowel disease and it's an autoimmune disease because it involves the immune system mistakenly attacking its own gastrointestinal tissues. And that's how I think I'm going to describe it. Yeah.
And what are some of the biggest signs of Crohn's disease that people have, but they might not realize they do have it?
So the biggest signs would be like a cobblestone-like appearance on a colonoscopy. And doctors, they usually do so many tests and, blood tests, biopsies and endoscopies and colonoscopies, but it's so hard to differentiate Crohn's from ulcerative colitis or SIBO. But this kind of appearance basically results from presence of deep ulcers, fissures, that separate areas of swollen, inflamed mucosa. So that's where the gastroenterologist really gets to know that it's Crohn's.
Interesting.
Mm.
Are there certain foods or lifestyle habits that tend to make things worse for people with Crohn's?
So I really believe that everything like lifestyle changes, the choice of food, and it has an effect on us and our genes. And the study of epigenetics, like how environmental factors, behaviors can influence gene expression without altering the DNA sequence itself. So essentially, it explores how genes can be turned on or off based on external influences like diet, stress, lifestyle, toxins. For example, like there can be two twins having the same genetic code
Mm-hmm.
in environments, even disease susceptibility. Yes.
Hmm. Um, I mean, being a health coach myself, I know that, like, we come up with, we always come across people with IBS and ulcerative colitis and different kind of conditions. So, how different Crohn is to those diseases, other gut health issues?
Right. So, Crohn's and ulcerative colitis both are IBD. They both are inflammatory, autoimmune. And the only difference is the parts of the intestine affected. So, Crohn's would occur from anywhere from mouth to anus, but most commonly in the small intestine and colon. But the ulcerative colitis would affect majorly the large intestine. That's how you get to know the differences between them. And on the other hand, IBS is a very different disease from IBD because it includes physical changes in the gut lining, which hinders absorption, digestion, and all normal functions of digestive system.
And do you think the med
Yeah.
traditional medical approach to Crohn's is enough, or is there more to the story?
Well, there is definitely more to the story, and I have dealt with clients who have come to me when they were on 20 years of on different kind of allopathic drugs. One of them was on different kind of drugs like JAK inhibitors, and they were on clinical trials. And but when she came to me, I had to sit with her and we did a meal plan. We did all kinds of different herbs, and we saw improvements in 6 months. She was on her feet. She was living a normal life, no stress. She could eat and cook for herself. So that was like a big, big, big milestone achieved.
That is incredible. Absolutely incredible. Well, I mean, Obviously, you're an expert in this area, and you said, like, during those 6 months of healing, how much, like, I'm just thinking about it. It's like, how much does what we eat really impact Crohn's? Are there food you swear by or tell people to run away from?
So it highly depends to what kind of food the client is intolerant to. We really take the histaminic foods, the tyramine rich foods in our diet, and we see, for example, if pick an histaminic food, bananas, pineapples, strawberries, tomatoes, spinach, certain nuts, even sauerkraut, the pickles and fermented vegetables,
Mhm.
they all have histamine in them. But sometimes some of the patients they don't show any flare-ups, and sometimes the same food would stimulate a flare-up. So I really think that food has a big impact, and especially foods containing histamine, tyramine can be very troublesome. So the way I handle Crohn's is I personalize protocols and not one size fits all. So I really work on one-to-one individual personalized protocol for every patient.
I mean, obviously, we are all bio-individual, isn't it? Speaking about like environmental factors you mentioned earlier, obviously stress is one of the subjects that we can't really overlook. And considering gut and HPA access, so stress and the gut are so connected. I mean, basically. And what are some ways people with Crohn can manage their stress level better?
Stress management is very personal, and reducing stressors like work overload, social pressures, they can minimize flare-ups. And like I said, a diet tailored to Crohn's needs can prevent digestive discomforts, reduce stress related to symptoms of Crohn's itself, because sometimes people are just in stress because of their disease. And
Mhm.
so yeah, that it itself is so stressful, to manage Crohn's. And I would say you really need a health coach. You need a personal one-to-one health coach who is there for you to guide you, what kind of groceries you can buy, what kind of, restaurants you can go to, what kind of meals you can prepare at home. And that can be one way to reduce stress. Yeah.
But tell me, what's your take on gut bacteria, general microbiome? How does it affect the Crohn's in general? And can we really heal the gut with the right approach?
So this can be very controversial to some of the doctors who advocate the 4 Rs. And the 4 Rs are remove, replace, reinoculate, and repair. Now, when I was dealing one-to-one with my clients, I saw we were removing all the harmful, toxins, pathogens, inflammatory foods, and anything which could damage the gut lining, like the histaminic, tyraminic foods. And we were replacing with anti-inflammatory foods, that sometimes you put in digestive enzymes, nutrients, or whatever the stomach acid needs for its proper functioning. But I saw in my practice when we introduced microbiomes like probiotics and probiotic foods, the kimchi, sauerkraut, and fermented vegetables, pickles, there were flare ups. There were bad flare ups.
Mhm.
And so I came to a conclusion that gut needs to repair first. The gut lining, the porous gut lining, which is where everything leaks into the blood capillaries, that's where the flare up starts. And that needs to be, closed and not open. So for that, I really advise and I really push bone broth, glutamine, amino acids, and things which could heal the gut lining, make it smooth. And then we re-inoculate the healthy bacteria. Sometimes we don't even need to reinoculate healthy bacteria. If you're having your prebiotics, your cruciferous vegetables, sauerkraut, and synbiotics, the bacteria, they repopulate themselves, and they automatically replenish the whole, ecosystem. Our body is an ecosystem. So I love this idea of naturally just, because probably I'm a natural health practitioner, naturally providing the right environment for the microbiome to grow.
I mean, you
Yeah.
mentioned about the natural alternatives about sauerkraut, cruciferous vegetables, and the amino acids. Um, did you find any supplements as well that truly make a difference?
So yes, I did. From my study of the prophetic medicine, I found boswellia very, very good for inflammatory bowel. It's also known as Indian frankincense, and there are supplements out there. You can select the best choice. And then in my daughter, I saw chlorophyll drink worked as magic. Subhanallah. Like chlorophyll was supporting her gut lining integrity, with helping with the leaky gut and intestinal inflammation. And after that, you'll be amazed, Nora. I don't really want to tell this to other people because I don't want them to try it on themselves. But from gluten free, she went gluten. So she was eating with us too. Before I had to buy
Yeah.
gluten free flour, gluten free cakes, gluten free pizza dough for everything. And now, after this, I think she's been on 10 days on chlorophyll and she's eating normal food.
That is incredible. That is incredible. Is it due to because she was a child, or it actually can work in adults as well?
It can work in children as well. Yeah, it can. Because it has all the natural plant source, which basically it works on reducing the porosity, the permeability of the intestinal lining. So the food doesn't really cross through to stimulate or exaggerate the immune system and the reaction of inflammatory mediators. That doesn't even happen. It just stops right there in the stomach.
That makes sense so
That's
much.
really cool, yeah.
Say, for example, if someone with Crohn's wants to start making changes today, so what's the first thing you'd suggest them to do?
I would say just keep a track of foods which you're intolerant to. And sometimes we just, go off track. We don't really jot down the foods which causes flare-ups. And if you've achieved this, then move to designing a diet to keep inflammation as low as possible. Like I said, there's no one size fit all, and giving plenty of time for the intestinal lining to heal. And I also like GAPS diet by Dr. Natasha Campbell. I think she has done an amazing work um, in the gut and psychology diet. It really works on intestinal healing.
Mhm. Beautiful. Awesome. I mean, obviously you mentioned about this lady who healed within 6 months, and also you spoke about your daughter's specific case. Do you have any other favorite client success stories that you would like to share with us? Someone who made an incredible transformation. I mean, I would love to hear about these stories more.
Yeah, so there is a client of mine. She made an incredible transformation. Her CRP levels drastically reduced after being 3 months on Boswellia, and her doctors were amazed, like, how did you do this? Or how the CRP levels are low, and what's happening? And I told her, tell them what you did. But of course, they wouldn't have accepted Boswellia as, a drug. But you can put it in the alternative, holistic, herbal medications or supplements. And but I saw amazing results in her inflammatory mediators. All of them were going down in the right range. Even her neutrophils, her white blood cells, everything, and it was mind blowing. Yeah. It was amazing to see her recover, and she still is in touch with me, and it's nice to see people, falling back in the right place,
It's so beautiful.
becoming a leader.
It's beautiful.
Yes.
Seriously. What are the biggest struggles your clients face, and how do you handle, or how do you help them push through?
So I think the biggest struggle my clients face are just self-sabotaging. And then sometimes they would believe that it's us, our bodies are so bad, we are born like this. I have to convince them mentally that you can do it. And so when they work with me, we build on eliminating triggers, forming meal plans, and which helps their gut to keep their brain illuminated. Because gut is the second brain, the gut brain axis. And then I have to work with them on one-to-one that it's not you. You can do it. Giving your body the right environment, right food, right kind of wholesome things, and you will see it flourish. And then they see it flourish.
Yeah. I mean,
Yeah.
obviously people make up stories for themselves, like, as you said, like everyone is bio-individual. They do see the reason or root cause in different things. But what's that one common myth about Crohn's that people have that you wish they would understood that it's not the case?
So the same, like if you believe that you're focusing on eliminating toxins and environmental triggers and keeping your terrain clean, and then I really emphasize on the lifestyle choices, nutrition, holistic health, and because this people don't really believe, they want one silver bullet which can just correct everything in their
Oh,
system.
yes.
We don't work on treating symptoms. If we work on treating one symptom, another symptom would appear. So we work on treating the root cause.
Absolutely.
Yeah, that's what,
Because you
yeah,
didn't get sick in one day and you wouldn't heal in one day. You will have to have patience in it, isn't it?
isn't it? Yeah.
If someone just got diagnosed, let's say just freshly diagnosed, maybe, and feel obviously overwhelmed, what's the best advice you would give them?
I would say build healthy habits. Don't give up. Don't think that your body lacks the coping mechanisms to heal itself. It doesn't absolutely it doesn't, like from cellular immune responses to regeneration, balancing the right microbiome, then recovery. Like even if you look at stress, the cortisol regulation, the endorphin release, these are all natural processes, the negative feedback loop. And to recover from any illness, everything just, it works, it has to work in harmony. And everything begins from the right mindset.
So true. So true. If someone wants to dive deeper into gut health, are there any books or resources or any kind of tools you would recommend?
Absolutely. There is one, my book. It will be uploaded soon on my website. You can go and purchase it from there. It's called Crohn's Disease Integrating Medicinal and Natural Approaches.
That's very
It's
helpful.
kind of a self-help book. So it can help you, discover your pathways, how to negotiate your body and yourself, your mind.
Any other resources or tools?
You can, or if you want, you can book a consultation with me, one-to-one. I can leave my WhatsApp number, and my business WhatsApp number is +1 587 897 6202. You can email me on the natural healing haven at gmail.com, and I can provide you with protocols and so many self-help material.
And that's beautiful. Okay. I think we'll also publish all the details online so that people can find you easily and connect with you. I mean, we've had an amazing talk, but it's been very inspirational and very helpful, at least for me, and I'm sure the viewers are going to benefit as well. So, coming to an end, final question I have for you. If you could leave our listeners say one powerful message about gut health, what would that be?
So I would say that a healthy gut empowers a thriving body and resilient spirit. You deserve both,
Beautiful.
right? Yes.
Mimi, it's as usual. I really enjoyed our talk. Thank you so much for your time. I really appreciate your effort and knowledge that you shared with us today. Um, Hope we're gonna have a lot more deeper into the gut health in our future episodes, but this was absolutely eye-opener for me. Thank you so much.
Welcome, Nara, and I hope in the upcoming podcast we're able to grasp more knowledge from you. And I think you have a long way and experience to guide our audience. So thank you for tuning in, everybody. And if you have any questions, just pop them below in the comment box. Thank you.
Thank you.